So this is actually an investigator-initiated trial that we wrote, really trying to focus in on a group of patients that I think that's excluded from a lot of clinical trials. So these patients that have MDS, MPN overlap syndromes, and those that have chronic neutrophilic leukemia. A lot of our treatment for these patients really is extrapolated from what we do for myelofibrosis patients or for MDS patients, but really they don't get a lot of focused investigation into their disease. And so we were looking at a drug called Fedratinib, which is obviously approved for myelofibrosis, but has some unique characteristics about it. It's a JAK1, JAK2 inhibitor, also inhibits BRD4, also downregulates MYC. These are some targets and pathways that we think are particularly relevant in these MDS, MPN overlap syndromes that may not use JAK2 as their proliferative driver, may have some other alternative drivers to that as well. And but at the same time, we also know that given the JAK2 inhibiting properties of Fedratinib, it likely has a role, especially in diseases like chronic neutrophilic leukemia that have CSF3R mutations. And so we enrolled this kind of subset of patients. It's really an amalgam of patients with these MDS, MPN overlap syndromes that we look at as distinct disease entities, but prior work has suggested they're more along the spectrum of diseases. And so what we've seen in this kind of early results, preliminary analysis is quite impressive response rates in this group of patients. So getting some good clinical benefit in terms of symptom and spleen responses across this group of patients that have really a challenging disease to treat. And we'll be presenting updated results at the meeting as well. And we certainly look forward to fully enrolling this trial and seeing exactly what we can bring. And I think what's really important to me about this trial is looking at some of the translational correlative data that will emerge to see exactly what's going on and how are we impacting the underlying disease process.